The respiratory system. Cells continually use O2 and release CO2. Respiratory system designed for gas exchange. Cardiovascular system transports gases in blood. Failure of either system. Rapid cell death from O2 starvation. Human lungs. Respiratory system anatomy. Nose. Pharynx equals throat. Larynx equals voice box. Trachea equals windpipe. Bronchi equals airways. Lungs. Locations of infections. Upper respiratory tract is above vocal cords. Lower respiratory tract is below vocal cords. Trachea size is 5 in long and 1 in diameter. Extends from larynx to T5 anterior to the esophagus and then splits into bronchi. Layers. Mucosa equals pseudostratified columnar with cilia and goblet. Submucosa equals loose connective tissue and ceromucous glands. Hyaline cartilage equals 16 to 20 incomplete rings. Open side facing esophagus contains tracheal SM. Smooth. Internal ridge on larynx called carina, cough reflex. Adventitia binds it to other organs. Histology of the trachea. Ciliated pseudostratified columnar epithelium. Hyaline cartilage as C-shaped structure closed by trachealus muscle. Trachea and bronchial tree. Airway epithelium. Ciliated pseudostratified columnar epithelium with goblet cells produce a moving mass of mucus. Bronchi and bronchioles. Primary bronchi supply each lung. Secondary bronchi supply each lobe of the lungs, 3 right plus 2 left. Tertiary bronchi supply each bronchopulmonary segment. Repeated branchings called bronchioles form a bronchial tree. Histology of bronchial tree. Epithelium changes from pseudostratified ciliated columnar to non-ciliated simple cuboidal, and finally to simple squamous as passed deeper into lungs. Incomplete rings of cartilage replaced by rings of smooth muscle and then connective tissue. Sympathetic venous and adrenal gland release epinephrine that relaxes smooth muscle and dilates airways. Asthma attack or allergic reactions constrict distal bronchiole smooth muscle, lobules. Structures within a lobule of lung. Branchings of single arteriole, venule and bronchiole are wrapped by elastic CT. Respiratory bronchiole. Simple squamous. Alveolar ducts surrounded by alveolar sacs and alveoli. Sac is 2 or more alveoli sharing a common opening. Histology of lung tissue. Photomicrograph of lung tissue showing bronchioles, alveoli and alveolar ducts. Cells types of the alveoli. Type I alveolar cells. Simple squamous cells where gas exchange occurs. Type II alveolar cells, septal cells. Free surface has microvilli. Secrete alveolar fluid containing surfactant. Alveolar dust cells. Wandering macrophages remove debris. Alveolar-Capillary Membrane. Respiratory membrane equals half micron thick. Exchange of gas from alveoli to blood. 4 layers of membrane to cross. Alveolar epithelial wall of type I cells. Alveolar epithelial basement membrane. Capillary basement membrane. Endothelial cells of capillary. Vast surface area equals handball court. Details of respiratory membrane. Double blood supply to the lungs. Deoxygenated blood arrives through pulmonary trunk from the right ventricle. Bronchial arteries branch off of the aorta to supply oxygenated blood to lung tissue. Venous drainage returns all blood to heart. Breathing or pulmonary ventilation. Air moves into lungs when pressure inside lungs is less than atmospheric pressure. Increase volume of lungs, Boyle's law. Air moves out of the lungs when pressure inside lungs is greater than atmospheric pressure. Passive process. Atmospheric pressure equals 1 atmosphere or 760 mm Hg. Boyle's law. As the size of closed container decreases, pressure inside is increased, inverse relationship. The molecules have less wall area to strike, so the pressure on each inch of area increases. Dimensions of the chest cavity. Breathing in requires muscular activity and chest size changes. Contraction of the diaphragm flattens the dome and increases the vertical dimension of the chest. Contraction of external intercostal muscles elevates ribs and increases diameter of chest. Inspiration, diaphragm moves 1 cm and ribs lifted by muscles. Intrathoracic pressure falls and 2 to 3 liters inhaled. Expiration, passive process with no muscle action. Elastic recoil and surface tension in alveoli pulls inward. Alveolar pressure increases and air is pushed out. Summary of breathing: alveolar pressure decreases and air rushes in. Alveolar pressure increases and air rushes out. Alveolar surface tension. Thin layer of fluid in alveoli causes inwardly directed force equals surface tension. Water molecules strongly attract into each other. Causes alveoli to remain as small as possible. Detergent-like substance called surfactant produced by type II alveolar cells. Lowers alveolar surface tension. Insufficient and premature babies so that alveoli collapse at end of each exhalation. Pneumothorax. Pleural cavities are sealed cavities not open to the outside. Injuries to the chest wall that let air enter the intrapleural space. Causes a pneumothorax. Collapsed lung on same side as injury. Surface tension and recoil of elastic fibers causes the lung to collapse. Lung volumes and capacities. Tidal volume equals amount air moved during quiet breathing. MVR equals minute ventilation is amount of air moved in a minute. Reserve volumes, amount you can breathe either in or out above that amount of tidal volume. Residual volume equals 1,200 milliliters permanently trapped air in system. Vital capacity and total lung capacity are sums of the other volumes. Dalton's law: each gas in a mixture of gases exerts its own pressure, as if all other gases were not present. Partial pressures denoted as P. Total pressure is sum of all partial pressures. Atmospheric pressure, 760 mm Hg, equals PO2 plus PCO2 plus PN2 plus pH2O. External respiration. Gases diffuse from areas of high partial pressure to areas of low partial pressure. Exchange of gas between air and blood. Deoxygenated blood becomes saturated. Compare gas movements in pulmonary capillaries to tissue capillaries. Internal respiration: exchange of gases between blood and tissues. Conversion of oxygenated blood into deoxygenated. Observed diffusion of O2 inward. At rest 25% of available O2 enters cells. During exercise more O2 is absorbed. Observed diffusion of CO2 outward. Hemoglobin. 4 He molecules each bind 1 oxygen molecule. Oxygen transport in the blood. Oxyhemoglobin contains 98.5% chemically combined oxygen and hemoglobin. Inside red blood cells. Does not dissolve easily in water. Only 1.5% transported dissolved in blood. Only the dissolved O2 can diffuse into tissues. Factors affecting dissociation of O2 from hemoglobin are important. Carbon dioxide transport. 100 milliliters of blood carries 55 milliliters of CO2. Is carried by the blood in 3 ways. Dissolved in plasma. Combined with the globin part of Hb molecule forming carbaminohemoglobin. As part of bicarbonate ion. CO2 plus H2O combine to form carbonic acid that dissociates into H plus and bicarbonate ion,